Today's podcast will be about the decolonization of global health. To begin, first we have to understand what this topic means. What does it mean to decolonize global health, and to be able to do so we have to understand the rooted history of why it became colonized in the first place. Since the start of colonization in the United States, there has been a lack of regards towards groups of people considered to be less than human. This, of course, over time has played out in history and how certain cultures are treated throughout historical events. As a cause of these events in our past history, there has been lingering problems to this day that some people as well as the government refuse to accept. In return, racism within the health system has caused mental health problems in certain ethnicities, which is why we have to analyze this in a narrow light. An example of this is when Fanon focused on medicine and colonialism. Attitudes of people started to be provoked by the oppressive system. In this society, doctors belonged to the military conquest and police system. The military conquest and police system led to colonization. The French medical service couldn't be separated from French colonialism. When there was no colonialism in the society, patients that were sick could go to their medical practitioner with confidence. Patients trusted their doctors and could understand what had to happen in order for them to get better. Once colonialism came around, patients, or in this example, Algerians, avoided hospitals for dozens of years. They wouldn't go see their doctors even if they were severely ill or their life was endangered. They waited until the last moment to go to the hospital. They only went to the doctor as their last option, and this usually ended in death. When colonized people went to visit the doctor, the visits weren't very pleasant or successful. This made the patients feel like they couldn't trust the doctors. The relationship between doctor to patient was really poor. Doctors would prescribe medication and the patient wouldn't follow the instructions. This is just one example of the things that the French colonialism had on Algerians.
Part 2, Intervention and Inclusion in the Decolonization of Biomedicine. After World War II, the theory and application of eugenetics was losing popularity within the science and medical community, and social sciences such as anthropology and sociology began gaining recognition in the developed world. Beginning in the 1950s, the practice of cultural humility began to shape the attitudes of social and medical science alike, where medical anthropologists focused on different explanatory models of the cultural expression of disease. The attitude of biomedicine, once having a reputation as the unquestioned singular method of treatment, began to shift at this time, despite some objections from an already overworked medical students. Cultural competency classes began to be included alongside their medical training and curriculum. This was to increase the residents' awareness of the cultural, social, and economic factors that led directly to health disparities amongst different groups of people, not only in the US, but globally to other countries where Western countries had the desire to assist in the recovery of colonized and war-stressed societies. The emergence of training community members within these disparaged communities outside the United States and basic, simple, and effective treatments, because many doctors and nurses that stayed in their own country experienced brain drain. And by training these laymen to provide basic care to their community, it was shown to bridge the gap between the two spheres of healing practice. The community health care provider would unlikely migrate away from their village, may experience a positive transition within rank of their community. However, there has been some strain in the matters of restitution for their work. The emergence of NGOs and humanitarian aid in other countries that can often be a hindrance rather than helpful, and to many countries that were ravaged by colonization. For example, the rice that American farmers grow for food and to aid in places like Haiti often had negative impacts on the community as a whole. Instead of doling out proper farming amenities to have the locals work and cultivate their own land and eventually have the opportunity to enter into global markets themselves, they would just provide them with food. Another effect is that many indigenous populations still suffer disproportionately more than compared to the rest of the general population. If a population is sick, it cannot work. Traditional intervention and ritual, unfortunately, cannot bear the burden of healing alone, since these communities have had a plethora of Western diseases exposed, including mass deaths within their society. So it is imperative that there must be a mutual and reciprocal relationship between the two healing spheres.
The Kumeyaay are one of the major tribes hailing from the local San Diego region, and they serve as an example of the brutal effects of colonization has had on the local area. These initial contact that the Kumeyaay had with non-Native Americans was with the Europeans, as the Spanish established a missionary line down the coast and attempted to bring the local people under the cross through forceful means, which often resulted in genocidal actions and the forced displacement of these people. Americans were the last major example of colonization towards these people, as they attempted to move the Kumeyaay onto reservations, which often came with poor resources. This all led to the Kumeyaay occupying a land that was a shadow of what it was, and their native lands being taken away. Some of the solutions that the United States government has come up with in recent years to deal with these problems were as follows: subsidized housing, education, and healthcare. The issue with all three of these were they were often of very poor quality and not very well funded, and as such, they were often extremely ineffective. Hundreds of years of colonization cannot simply be undone with such simple and poorly funded programs of such low quality, and a large percentage of Native Americans today are facing poverty and high rates of health problems, such as diabetes, substance abuse, alcoholism, and mental health issues. What can be done, however, is a quality infrastructure can be built to help support these Native American tribes. This includes improved quality of education and programs to help Native Americans receive higher education, better access to jobs, which can help with housing and general economic situations, and better healthcare so that these health issues may be resolved.